Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening and a warm welcome to another edition of your Health and Wellness Show. I'm Hawa Solomon. Stay with us for the next hour because we want to hear from you as we highlight breast cancer. Yes, it's the month of October and worldwide everybody is talking about breast cancer. So why are you not? And I'm going to leave that. Anesthesia. I said it right earlier. How are you doing, Dr. Zeenat?
So good to be here and to highlight this topic.
Absolutely. And she's also a member of, which we've been trying for a long time, executive member of the IMA, Islamic Medical Association.
Yes,
so happy to have IMA in studio with us, highlighting this. I know the IMA has been doing some great work with regards to awareness as well around the country. So we're very pleased to have you and your team, do some great work, the initiative, and to have you here in studio with us.
I'm so glad to finally be in studio with you, both as part of the breast care team and as part of the IMA.
Very, very happy. And then we're going to be chatting to Ade a little bit later on, but let's get into it. Some of the stats, and every year, we do a show on this, and it's alarming how the numbers just goes up, and the awareness is not all there just yet. We know that COVID hit us, so this is also post-COVID. I've also heard of cases where women are actually not aware of their status, and all of a sudden when they've gone for their screening, not realizing that they needed to even. So let's start there. The importance of screening, mammograms, how prevalent breast cancer is, Dr. Lucian.
Okay, so I absolutely agree with you. I think coming from COVID and coming from lockdown, I think a lot of other conditions have been neglected. Yeah. I think women have neglected their screening, through no fault of their own. When we were in hard lockdown, a lot of the mammogram units were closed. Women had nowhere to go. And we do see more advanced cancers. We do see cancers that have been neglected because of the COVID pandemic. And breast cancer is incredibly common. It's the most common cancer in women in South Africa and worldwide. So a few years ago, cervical cancer was still the most common cancer in women in South Africa, but that's now been overtaken by breast. So breast cancer is the most common cancer. And if we look at the figures, there's an approximate sort of 1 in 27 risk for South African women, sort of across all racial groups.
Yeah, and,
so
and I've just read some stats around the world. It's 1 in every 8.
Yes, sure. Yes. So very, very common.
Okay, let's look at some of the causes of breast cancer. Why are people getting breast cancer?
So there really isn't, there's no single cause that we can pinpoint. It's most likely a combination of factors that are at play. But we do know about some high-risk factors that will make a woman more prone to developing breast cancer. And I think, I think you have
Dr.
a few words.
Please elaborate.
So like Lucy said, that there isn't a single factor that's been proven to cause, but some of the associations we know about. So a lot of people are worried about the family risk. I think that's a question we get often. So there is a strong genetic association with certain types of breast cancer. So there's genes that we know of that are called the BRCA1 and 2 or BRCA1 and 2. So if you have first-degree relatives with breast cancer, and the more first-degree relatives you have, the earlier they were diagnosed, it may be worth looking into getting genetic studies done for different patients with the cancer. Some other associations we have, there's a strong association with hormones. In that, it can be that you got your period when you were very young, you reached your menopause when you were very old, so you're exposed to estrogen for a longer period. Fewer pregnancies, some association with women taking hormone replacement therapy as well. Okay. We know patients who've had previous breast cancer or even non-cancerous breast lumps have a higher incidence of breast cancer. And then there's things like age. It's more common in women over 50. And then lifestyle factors. So overweight, alcohol use, all of these things can also cause can also be associated with breast cancer.
And I think we all fall into that category of not looking after ourselves, of not watching what we're eating, our weight, not just what we're taking in, but how much it's weighing on us. So let's look at who and how it is diagnosed, Dr. Lucian.
Okay, so generally, breast cancer is diagnosed in one of two ways. So the first way is a woman will present with a symptom. So she will go to her GP. And notice I'm saying a woman, so men also get breast cancer, but more common in women, so I'm going to say a woman. So a woman will present to her GP or whoever she sees for her health checks, her gynecologist perhaps, and she will have a breast symptom. So most commonly that'll be a breast lump, but it might also be a change in the size or the shape of the breast. So the breast might become bigger than the other side or smaller than the other side. She might have something strange pop up on the skin, so a dent or a dimple in the skin. The nipple might be pulling in where it was never like that before. Or she might have a nipple discharge. So we specifically look for a blood-stained nipple discharge.
Okay.
So often women will present with these symptoms and then we'll sort of go into the pathway towards diagnosis. But there's also another way that it can be diagnosed, and that's what we actually prefer. And this is why mammograms are so important, because we'd like to diagnose cancer before it's even apparent in the breast. So before you can even feel a lump, before you can pick up any changes on your self-examination. The cancer can actually be picked up on a mammogram long before it's palpable, so long before you can feel anything in your breast.
So that mammogram, that word mammogram, is so super scary for everyone. Let's just talk us through the mammogram. I'm going to leave the floor open to Dr. Zenit or Dr. Lucian, who's going to take up the challenge to talk to us about a mammogram. What's happening? What are the myths and misconceptions about mammogram? I know this is not what we discussed, but just hearing that word, it just scares everybody, because I'm actually due for a breast scan, and yes,
Yeah.
and I'm sitting in the hot seat here. I'm literally getting chicken skin, like they say, hearing about all of this, because honestly, if I could just paint a picture, is that it's in my family as well. And my mom has been saying, "Oh, you need to go for a mammogram. Please go. COVID's finished," and you just make a date. So tell me, what can I expect?
So first of
going
all, I think you should listen to your mom and get your mammogram. Mom is always right.
Yeah.
So mammograms are usually done as screening in women over 40. Then depending on your risk profile, that will determine how often you need to go for your mammogram. It's usually done in a specialized radiography suite. And yes, it is uncomfortable, but it's not unbearably painful. There'll be some discomfort, there'll be some squeezing. What they need to get is a picture of your breasts to see any abnormal areas. And just about mammograms, it's very important, if you can, to have continuity at the same center. But even if you don't, just to keep a record of your previous mammograms, because what's very important is often changes from year to year, so that they can see something that maybe wasn't there last year or wasn't there 5 years ago at your previous mammogram that is now there and abnormal.
So what are we saying? We're going 5 years, every 5 years, or every year?
So, depends on who you listen to. This is a very controversial topic.
Okay, let's look at all points. We don't have enough time, but let's do it.
Okay, so from the medical aid side, for a woman at average risk, a woman who doesn't have a family history or a high risk factor, for those women, the medical aid will usually pay for a mammogram once every 2 years. From the Radiology Society, their recommendation is actually from the age 40 onward to have an annual mammogram. And I absolutely agree with you, Z. I think going to the same practice, or at least keeping a record of your previous mammograms, is so important, so that we can see a change over time. I know everyone cringes when they hear the word, because they're thinking about that squeeze.
Yeah.
But there's a few things that you can do to make it a little bit more comfortable for yourself. So first of all, it's about timing. So in certain parts of your cycle, your breasts will be more tender. So if you sort of know in which parts of your cycle your breasts are usually tender, try and schedule your mammogram for a time when your breasts are less tender.
Okay.
You can also take a mild painkiller before you go for your mammogram, which can also help with the discomfort. And I think it's also important to speak to the radiographer. I think if you just say to them, look, the compression is quite sore, do you mind releasing it? You know, they'll do whatever they can to make you more comfortable. Also, when you're at the machine and you are standing, face the machine. Try not to twist your body, so face the machine with your body and your head, so that you're not twisting yourself in the machine.
That could maybe cause a little bit more pain.
It can also cause a bit of discomfort. And if you're uncomfortable standing, mammograms can also be done sitting. So you know, just to communicate with the radiographer, and they'll be able to help you and make you more comfortable.
Dr. Zia, anything else you'd like to add?
No,
help me along. Okay, she's covered it
all. But I also just want to add, if you're under 40 and you do feel a lump, you can still have a test, and usually they'll do an ultrasound on the denser, younger
Why
breasts.
would you need to want to do that?
If you do feel a lump or a discharge or any of the signs that we spoke about, you don't have to wait till you're 40 for a mammogram. You can chat to your team, chat to your GP.
If you're worried either way.
And they can still send you for other investigations.
So let's talk diagnosis. And often, you know, they hear, you know, women or men, when they hear their diagnosis that they've got breast cancer, it is quite scary. It's shocking. There's something that, you know, just in denial. You're just going in some sort of denial. So I want to know, and when we'll come back with this question, can you go for a second opinion, and why should you go for a second opinion? But we'll deal with that question just after this. Stay with us as we create the awareness around breast cancer. And yes, we've been talking about it for years. Every year, this time, October, it happens, but not enough is said. So stay with us. More after this. Don't go anywhere. Welcome back. Assalamu alaikum. A very good evening. And if you're listening to us across the lands and over the beautiful seas, thank you so much. You tuned in via our website, live streaming www.hilaal.tv. And you can tell the rest of your family and friends, of course, if they're not on the DSTV platform, they can join us via our website. Do note that we are taking your calls, comments, questions, and queries, and maybe your heartwarming stories on breast cancer. The awareness here is for you to spread the word. I'm due for a mammogram. Are you going? Let's chat to our breast cancer care team in studio with us, Dr. Lucian, specialist breast surgeon, and Dr. Zina Dadabai, anaesthetist, specialist anaesthetist in studio with us, as well as our survivor who is already online. Very excited to chat to her as well. But let's get down to some of the questions, and I said before the break. Can you go for a second opinion? Why would you go? And yeah, what would be the reasons to do that? And what would be the possible other questions that you could ask your second opinion doctor?
Okay, so I think the most important thing for someone who's been diagnosed is to be comfortable with their team.
Okay.
Because the breast cancer treatment process is quite a long road that you have to walk. So you're going to be seeing your specialists quite often. You're going to be seeing them for the rest of your life. Once you've been diagnosed, we are going to follow you up long term. And that's why I feel it's so important that you have to be comfortable. So if you are in a situation where you feel like you're not being heard, you're not being listened to, you're too scared to ask questions, then perhaps you should consider getting a second opinion. Right. Nothing wrong with it. No one will be offended. In fact, it's your right to ask for a second opinion. And I mean, if you feel like you'd like to go back to your first choice doctor, that's also fine. So nothing against that.
So calmingly, so well put. You just put it like it's nothing. Because often you think that you're going to offend the doctor, and there's, you know, going to be some bad vibes if you happen to see him or her again. But before we answer any other questions, Dr. Lucian and Zinat, we just need to take a quick break. Stay with us as we continue this conversation just after the short break. Don't go anywhere. We answer also your questions, so please send them through now. Back in a moment. Assalamu alaikum. Welcome back. A very good evening. And we are still chatting to our breast care team in studio with us, Dr. Lucian van Skalkwijk and Dr. Zenit, to get straight into the questions that we have. Some has also come from interest. So, Dr. Lucian, if I could just check in with you, and I appreciate, it's great to know that you have that care team. No matter which doctor you go to, you have to be comfortable with him or her. But who is that doctor? What type of doctor is doing the diagnosis and the necessary follow-up treatments?
Okay, so usually what will happen is a woman will go either to a GP or to a gynecologist, or straight to the radiologist. Radiology, I think, is sort of where everything comes together.
Okay.
So the radiologist will do the mammogram. That's usually combined with an ultrasound. And if they pick up anything abnormal on the mammogram or the ultrasound, they will then do a biopsy of that area. The biopsy is done under local anesthetic, so it's a needle biopsy. It's done under ultrasound guidance, so they put the ultrasound probe on the breast so that they can see that the needle is actually in the correct area. They remove a tiny, tiny piece of the tissue, and that's sent away to the pathologist, who will then have a look at it, and the diagnosis will then come from the pathologist. Once the diagnosis has been made, I think it's very important that the woman is referred to a specialist care team. We know that the outcomes are better when women are treated in a team that specializes in the management of breast cancer specifically. So usually your GP or your gynecologist, whoever referred you, will be able to refer you on to a specialist breast care team, or the radiologist might have a recommendation for you. And then once you are in the team or have been seen by a member of the team, we can then coordinate the care between all the different members.
Okay. So understanding the treatment, how soon does it start after you're diagnosed?
Okay, so I think it's a diagnosis that comes along with a great deal of anxiety, and I think a lot of women feel like they want to get this lump out as soon as possible. But I think it's important to understand that we have a few bits of information that we have to get together before we can make a proper decision. For example, we might need to do some more scans. You might need to see the oncologist first. So there's a few things we need to do before we can get going with our treatment. These scans and tests might take a week or a few days. And I think it's important to emphasize that getting all of that information and taking the time to make a proper informed decision is not going to have a harmful effect on you from a cancer point of view. So we don't need to rush. There's no need to have your operation tomorrow or to have it as soon as possible. We need to get all the information together so that we can formulate a proper plan. It's one of those things where you have to do it right the first time. There's no going back if you've made a mistake the first time around. So let's get all the information so that we can do things right from the very beginning.
So let's talk about the type of treatments that are available to cancer patients, breast cancer patients.
Okay, so I always say to my patients, it's the treatment for breast cancer is like a jigsaw puzzle, and we need to put all the pieces together to get a complete picture. If we have only some of the pieces and not the others, the picture won't be complete, obviously. So the main treatments that we have for breast cancer is surgery, so an operation. And then from the oncology side, we have chemotherapy, radiation, a few of the more modern sort of targeted medications that we can use. And we combine all of these elements. Back in the day, every breast cancer patient used to get the same thing. So everybody would have the same operation, the same chemotherapy, everybody would have radiation. So it was the same plan, it was applied to all different patients. But we now realize that we have to be more personalized in breast cancer care. So some types of cancer might not need chemotherapy, some might not need radiation. We have to personalize the plan according to the type of cancer that the patient has.
So Dr. Z, as Dr. Lucian calls you, Dr. Zina, tell us about the risks and possible benefits as we want from the treatment? What are they? And we understand that ultimately this treatment needs to help us, and this is what we need. But there's also that fear of the risks when we do take up treatment for breast cancer.
So I always tell my patients, so nothing in life comes without a risk. I can't tell you that the surgery you're having or the chemotherapy that you're going to have is going to be without risks and without side effects. A lot of it is personalized, and it will depend on the patient and what the patient's getting. And each modality of treatment can have different risks and different side effects. So I'll start with the surgical ones, because that's probably the one that I'm most involved in.
Yeah.
So there's risks to the surgery itself, and this will vary depending on what type of surgery you're having. So like Lucy's saying, every patient doesn't get the same surgery. A patient might choose to have a lumpectomy, where you're removing just the area that's cancerous, or a patient may need bilateral mastectomies, removing both breasts. Patient may need surgery of the axillary glands, and again, this can vary from taking out one gland to doing a full removal of the glands under the arm. So all of these different types of surgery will come with different risks. Patients are often terrified of the anesthetic, and that's that's I think the unknown. And I always tell them, I know it's very overwhelming. There's a lot happening in a shortish period of time, but my job is to get you through that as safely and as comfortably and with as few side effects as possible. So another side effect, patients are often worried about pain, and breast cancer surgery, we know, can be quite painful surgery. So in a specialized unit, in our units, what we do is we treat your pain preemptively.
Okay.
So before you even come to theatre, you're admitted in the ward, and we're starting to treat your pain. You'll get a little tablet, and we start to preempt the fact that your body is going to have.
First.
They do. You see me before surgery in the ward, but we preempt the fact that you're going to have a very painful insult. So what can we do to prevent that? And we give you something in the ward. Coming into theatre, once you're under general anesthetic, we give you a wide variety of different painkillers from different classes of drugs. Also give you local anesthetic. And then we'll chat to you beforehand about what our strategy is afterwards. So most of our patients will have a pump that they can give yourself some pain medication the night, especially the night of the surgery. We'll chat to you, and depends again on the type of surgery and the type of patient, because different patients may have different indications or contraindications for different drugs. Other risks with surgery, there can be risks, for example, if we're doing an axillary dissection, so we're going into all the lymph nodes in the axilla, you can get swelling of the arm, known as lymphedema, afterwards. We'll also tell you, if you've had that sort of surgery, to warn your team going forward not to have things like blood pressure cuffs or drips on that arm. And then the different other modalities, so for example, chemotherapy. Lots of patients, I think this comes in the broader society with a lot of connotations and a lot of fear. But your oncologist will chat to you, and will preempt things like nausea and vomiting and try and treat that. Losing the hair is a common side effect of chemotherapy, unfortunately, but hair does grow back. And inshallah, once the treatment's done and the chemotherapy stopped, depending again on what sort of chemotherapy you've had, how many cycles, etc., your hair can go back. Chemotherapy can have effects on other organ systems such as the heart, so your oncologist will keep an eye on you and on your functional status and your health as well.
Our breast care team is in studio with us, and remember, we are taking your comments, questions and queries on breast cancer. Please do keep them coming, but there's so much more that we need to know and delve into. One is specifically how to manage the side effects of those treatments, because you've mentioned some of the side effects now, Dr. Zeenat. It does become overwhelming. I think that nausea, that vomiting, that constant ill feeling, you realize that, I am sick. So how does one manage that side effects of the treatments?
So as Zeenat has said, I think we are very good at sort of preemptively managing the side effects. Our oncology colleagues have a full plan that they set up for every patient, and they treat these side effects aggressively. So we try and manage them as well as we can to try and give you the best quality of life, and so that you're not feeling poorly all the time. The other thing is, the chemotherapy, usually for breast cancer, it's about 6 months. And I always say to my patients, when you're standing at the beginning of it, it feels like a marathon that you're running. It feels like you're standing at the starting line of the comrades. But once you are in your treatment and you are undergoing your treatment, it flies by.
Yeah.
And before you know it, your treatment will be finished. And it's a great milestone to finish that treatment.
Absolutely, a great win at the end. We take a short break and we come back with the questions on when is that breast going to be removed? Why does it need to be removed? And that big question on the surgery of it. More after this. Stay with us as we highlight breast cancer awareness. And after the break, Rehana Kasim joins us, our breast cancer survivor. Stay with us. Assalamu alaikum. Welcome back. Breast cancer awareness is what we're talking about. We have our breast cancer care team in studio with us here live from Johannesburg in our studios in Rivonia, Johannesburg at Hilaal TV. So Dr. Luciana and Dr. Zenat, we haven't touched on the type of cancers yet because there is some concerns about, and I just did some research, there's some concerns that there is possibly breast cancer symptoms, but there's no lumps. And then there's different types of hormone cancers and related. So non-cancerous lumps and bumps, types of breast cancer, let's talk about that.
Okay, so even though we speak about breast cancer as one disease, breast cancers are not all the same. So we can divide them into different groups based on what sort of behavior we expect from the cancer. So I always say to my patients that we need to know whether your cancer is a kitten or whether your cancer is a lion.
Okay.
And we will treat our approach will be different based on what your cancer is. I mean, as you can imagine, you are going to approach a kitten differently from what you would approach a lion. Yes. And how we do that is by doing a few further tests on the biopsy. So on that biopsy specimen that the radiologist took initially, so that needle biopsy, the pathologist does a few extra tests on that. So amongst other things, they look at whether the cancer is sensitive to hormones, so estrogen and progesterone. They look at how rapidly the cells are dividing, et cetera, et cetera. And from that, we can divide the cancer into a group which has a specific prognosis. And just sort of speaking in broad terms, so let's say lazier kinds of breast cancer that grow more slowly or hormone receptor sensitive, those cancers we can sometimes get away without chemotherapy. We would rather just block the hormones, because for those types of cancer, the female hormones like estrogen and progesterone are like fertilizers, so they stimulate the growth of the cancer. Whereas with the more aggressive types of cancer, we might rather look at chemotherapy or some of the more targeted treatment. So it really depends on where you fall into those groups, and from there we can make a management plan.
Non-cancerous
non-cancerous lumps and bumps. So I think the first sort of reaction to finding a lump in your breast is absolute panic. I think your mind just goes to the worst case scenario, but it's important to keep in mind that there are lots of non-cancerous lumps. So, it's not necessary to immediately go to the worst case scenario, but it is important to have it checked out. So until you have it checked out, you won't know what you have. So go to the radiologist, have your mammogram, your ultrasound. So non-cancerous lumps, things like fibroadenomas that we commonly see in young women, those are completely benign lumps, so they're not cancers. They don't turn into cancers later on. They form due to the effect of hormones again, but they are completely benign. And then we also have things like cysts, nodular breast tissue that often goes along with cyclic breast pain, so pain that goes along with the menstrual cycle. And these things can also cause lumps. They can be quite bothersome, so they can cause discomfort, but generally not dangerous. And really the only way to know is to have it checked out.
Go check yourself. Screening, mammogram, whatever you need to do, go for it. Dr. Z, before the break, we spoke about the breast being removed. At what stage is it being removed, and how long is that breast cancer surgery recovery?
Okay, so what stage it's being removed is, like we were talking about, that is completely patient and cancer dependent.
Okay.
Because some patients will need chemotherapy before the surgery, some patients will have surgery at the outset, and they may have other treatment afterwards. So that depends, as we've spoken about, on the type of cancer that you have and at what stage of the cancer you're diagnosed in. So how far along is that cancer? In terms of recovery after the surgery, this again will depend on what type of surgery you have. So breast cancer surgery, like we said, can range from removing a part of the breast to removing the whole breast or both breasts, and may or may not include surgery into the axilla. So for just a lumpectomy or removing a part of the breast, about a week or two.
Okay.
For more extensive surgery, like your bilateral mastectomies or removing both breasts, you're looking at least 3 to 4 weeks of recovery time.
Okay. Then we don't all want to see this, but what other parts of the body and the organs does breast cancer affect when it spreads?
Okay, so the first place that breast cancer spreads to are the lymph nodes under the arm, which is why we often talk about them so much. And then from the lymph nodes, spread can be to various different parts, commonly bone, lung, and liver.
Okay. Wow. And what are the signs for when that does happen?
So if a patient comes with breast cancer, often what we'll test first, if it seems to have, so you may have different investigations done with the radiologists, with the cancer team. We keep on talking about the whole team. So they might scan the abdomen, they might be looking for these signs. A patient might present with a fracture that is not explained. You know, it wasn't a huge fall, so it may be an incidental finding in that way, that we work back towards the breast when it's already spread. But if you're diagnosed primarily as a breast cancer, the first thing we'll look for is whether or not it's spread into those lymph nodes.
Okay.
This can sometimes be done by we find the first lymph node that it may spread to, referred to as the sentinel node, and we test just that node. Then we know whether or not we need to look for further spread.
Does that mean now that the cancer is at a higher stage and more at risk?
Yes. So the earlier we find the cancer, the lower the stage is, the better your chance of recovery and of cure. Whereas the more extensive or the further the cancer has spread, that chance of complete recovery or cure does decrease.
And that's the next question.
That's why we
cure.
want you to do
go
your mammogram
early.
and to catch it early.
Yeah. So it doesn't go to that stage 4.
Exactly.
All right. So we have our breast cancer survivor online with us, Rekhana Kasim. Assalamu alaikum to you, Rekhana, and welcome to Hilaal TV. Are you with us?
Wa alaikum salam wa rahmatullahi. Yes, I'm with you, and thank you for having me.
So Rekhana, I've just read a little bit about you, and it's absolutely inspiring. Just takes one back, and there's no words to explain what an inspiration you are to me and also to many of the people that you have met. You are an educator, an activist, a breast cancer survivor, and you still keep going. I know it's a very busy month for you, so we appreciate your time.
Yes.
Rekhana,
Thank you.
just some quick questions. If we can look at your story, and I know there's so much to be said, and you can just Google Rekhana Kasim. She's on Facebook. She's got articles up. So you'll find her online if you have any questions. But what was one of the things that you wish you knew before you started your treatment when you found out you were diagnosed with breast cancer?
I was diagnosed 17 years ago. And if I always say at the time when I was diagnosed, there were never support groups where I could equip myself with knowledge. So if I just could know, if I knew more than what I know now, I'm more empowered now. I read up about it. When I was diagnosed, I didn't even know I thought cancer was a death sentence. I really thought I was going to die. And also, I didn't know what radiation was. I didn't know what chemotherapy was. I didn't even know about the stages and the grades. So I just wish I knew more, especially about doing exercise, stressing less, eating healthily, because I did all the other things. I have 4 sons whom I breastfeed. So yes, I just wish I knew a little bit more about cancer because I had more fear in me when I started the treatment because I feared the unknown. I didn't know anything. Nowadays, I challenge my oncologist, not challenge, but I would question her.
Yeah.
But when I was initially diagnosed, I accepted everything they said. If they said radiation, I said yes. Chemotherapy, I said yes. I had to choose between a lumpectomy and a mastectomy. I didn't even know what it was.
Yeah.
But when the doctor explained to me, I opted for the lumpectomy because I wasn't ready for a mastectomy. I wasn't ready at all.
So all these words have been flown around. What did you do to remedy that situation when it came to not understanding? And what message would you have to other breast cancer survivors and also, individuals like me that just need to know more about breast cancer?
I would suggest that go for your regular checkups firstly. Know your body, learn about your body. I went for my regular pap smears and I went for my regular breast checks and my mammograms until I was 46 years old. And then my gynae fell ill. And then I, and then I thought, after my gynae fell ill, I thought that I went for regular checkups, I should be fine. But then I found my lump, and my lump was there for about 2 to 3 years already. So what I'll say to others is know your body, go for your checkups, do what you must do, because it's really not an easy journey.
So, Rehana, if you could just tell us what was the biggest self-discovery or, something that just stood out, a revelation for yourself after you were diagnosed, that day, that minute, that reflection that just came to you after you were diagnosed?
I never knew that I was so strong. Cancer really taught me how strong I am. After learning more about the disease, it really showed me because when I was diagnosed initially, I was in stage 3, and then 4 years and 10 months later, I went for a bone scan, and it was back in my breastbone, and I just became stronger afterwards. Normally, people become depressed or they're disappointed. But because I had news like these are the news I had. Cancer first in the breast in 2005, then in the breastbone in 2009. Then they didn't outrule cancer in the hip. And then I went for second opinion and it was tendinitis. Then they told me it was in my skull. And then I told her, but she told me it is bone marrow expansion. And then again in my breast, they found another nodule. So because of all this news, and then once I was told in 2015, I was told I have cancer in the jaw and I went for a second opinion. So with all this news, it just made me stronger and wiser. And I use my journey to educate and inspire. But simultaneously, I also get stronger. It actually taught other people tell me, like buddies teaches me that I'm actually blessed because if I listen to others, they go through more. So yeah, so my cancers really just taught me to be a better person, wiser person. I use my journey to educate others because I wish I was educated before, and I did all the sort of right things besides the exercise. Because before cancer, I existed. After cancer, I actually founded my life. And today, although I'm metastatic, doctors gave me 5 years to live. It's been 17 years.
Oh,
I
mashallah.
outlived, I outlived my breast surgeon. I outlived
Sure.
my gynecologist. My oncologist is retiring. My dentist, he says to me, he's very scared
Wow,
of me.
wow, Rehana.
So yes, I have a relationship with all those doctors,
Absolutely.
and my cancer journey just taught me that there's actually a better life after cancer, a new life. I can say it's a blessing, but while I was on the journey, it was challenging, and I had to find coping mechanisms
Yeah,
because my kids were young, and now they are between 32 and 42. But at the time they were very young.
yeah,
It was like almost like cancer pushed me to survive, pushed me to the edge,
yeah,
and I really had to find coping mechanisms
yeah.
because there weren't any support groups at the time or any support.
Rehana, what a beautiful story, an inspiration, definitely. We have to wrap up with you and just conclude. We literally have a minute. And just hearing what Rekhana has said about some of the things that she was introduced to, that they spoke about and she didn't even know. Dr. Zenith, can I start with you, just as your concluding comments?
So, mashallah, Rehanna's story is so inspiring. I think it's a lesson for us also as doctors about how we need to speak to our patients and empower them and give them all the information to make the decisions that are right for them. I think it comes back to what we said in the start about finding a team that you're comfortable with and that you can speak to and challenge.
Dr. Luciana.
And well, I must say, just Ray's mindset is amazing. And I think her message is also so important. So even though the cancer has spread, even though it's a metastatic cancer, which is a stage 4 cancer,
Sure.
there's still treatment that we can give. And I find it so admirable, her mindset, the fact that she's educating others, it's amazing.
Absolutely. Thank you so much, Dr. Lucian van Skalkwijk, as well as you, Dr. Zina Dadabray, our specialist in studio with us, anaesthetist and general surgeon, but love and care for the breast and special care when it comes to breast surgery. Thank you so much for your time, both of you. Keep up the great work and spread that message. All the best till we chat again, and goodbye. Assalamu alaikum.
Assalamu alaikum.
There we have it, our breast cancer care team in studio with us. Remember that you can still comment and question via our various social pages, but you make the show. Spread the word. Breast cancer awareness doesn't just end here, not just for October, for the rest of the year and beyond. Talk to your family, talk to your children, talk to your girls, check in with your family and the females on your side if they had their mammogram. Go for your screening now. Make that appointment. From myself, Hawa Salman, it was an absolute pleasure chatting to you. Next week's show, stay tuned for diabetes post-COVID. All of that in next week, same time, same place. Wassalamu alaikum and goodbye for now.